These notes on the building fabric condition of the CMFI Bambuti Health Clinic in the east region of Cameroon were made in the course of a visit to Cameroon in July 2024. My visit was at the invitation of Mr. Patrick Mbala, a joint founder of Cameroon Catalyst, a charity devoted to improving the infrastructure for villages like Bambuti, in the region of Bambuti, in the East region. Notes on the medical facilities at the clinic have been prepared by two medical students who were also on the visit, Pam and Oscar, and are not covered here. Likewise, the condition of the electrical and mechanical services are not covered in detail, but are referred to in the photographs and in the body of the text. A site plan of the clinic is shown in Figure 1. As can be seen, it comprises 4 buildings built round a central quadrangle. The building fabric, from what I could see, the buildings are structurally sound, but have not been, and in my view have not been adequately maintained since they were built about 10 years ago. And the photographs that follow illustrate this. While I was in Cameroon, I had the opportunity of visiting the main clinic / hospital in the regional capital Bertoua, owned and operated by the Hope Foundation, and also another private clinic to the north of Bambuti, and some photographs of these two establishments are also included for comparison purposes. With a few notable exceptions, the building stock in the rural areas of Cameroon are poorly constructed and poorly maintained, but where, principally in the towns, construction is carried out using better and stronger materials, and the buildings are better maintained, the condition of the buildings remains reasonable through much of their life. Thus, in the case of the CMFI hospital / clinic in Bertoua and the Bambuti Health and the health clinic in Bambuti, if just a small proportion of the resources devoted to the upkeep and maintenance of the buildings of the former was applied to the clinic in Bambuti, the conditions would be noticeably improved. Even in the rural areas where better maintenance of the buildings is carried out, the condition of the building fabric and of the services is proportionately better. And one only has to look at the private clinic further north of Bambuti to see this. The scope of the maintenance work required is difficult. It's not easy to quantify. It not only includes repairs to the building fabric itself, but also to the rainwater goods, the rainwater harvesting system, in particular the collection tank, the potable water distribution system, which needs to be linked to the well pump, in which the water tower serving the clinic needs to be linked to the well pump and be regularly topped up, and the solar power unit needs to be thoroughly overhauled and made to work. My estimate of the cost of these works would be somewhere between £50,000 and £100,000 as a capital outlay, with a further expenditure of £10,000 per annum on maintenance. This does not include capital works or maintenance of the medical facilities. Stop.